As smart applications, we partnered with the Kenya Healthcare Federation, looking at how we could be able to enable the healthcare agenda in the country through data-driven decision making. And we are proud to launch this report where we're looking at healthcare statistics gathered from different healthcare facilities on what happened around the month of July in terms of informing how the civil unrest that we saw in that particular period may have contributed to certain demographics around healthcare. We are passionate about how the country can gain a lot more in terms of precise engagements and initiatives in healthcare through the use of data, through the use of technology, and through the use of empowered engagements with the different actors to achieve the improvement of quality of healthcare. Going into this report, which we did jointly with the Kenya Healthcare Federation, when we analyzed the perspective of healthcare access across that period, we noticed that indeed in the month of July, there was a drop of about 24.7% in terms of overall utilization, amount spent at the sampled healthcare facilities across Kenya. We were able to narrow down this to probably elements that arose from the restricted movements that happened during that period, as well as different elements that prevented access at the same levels as has been in previous months. In particular, we saw that there was increased expenditure in terms of access around the Kisumu region, with about 26% in terms of increased consultation access and 21% in terms of increased laboratory access. In Mombasa, there was an increase of about 5% in terms of increased medication access and about 5.8% increase in terms of consultation access. Smart-enabled solutions working with different stakeholders, and how this can inform preparedness in case of such eventualities if they should happen into the future, including other elements that inform different policies that are being put in place, both by government and private sector, in relation to achieving the healthcare needs or meeting the healthcare needs of our Kenyan population. So as smart applications, we are proud to have partnered with the Kenya Healthcare Federation, and this shows the undying commitment to working with different stakeholders in addressing and ensuring that the gaps around healthcare accessibility are resolved.
The Kenya Healthcare Federation is very, very keen on data-driven decision-making right across the health sector. Because if we make decisions that are not informed, then we are very likely to make the wrong decisions. It's highly unlikely that you'll ever make the right decision using the wrong information. If you do, it's luck. And that's why we partnered with SMART, not just on the effect of to get data in terms of the effect of the maandamano, but data to inform various other aspects of healthcare delivery. As is current now, we are looking at reforms at NHIF. And one of the key debating points is about the cost of healthcare across the various parts of the country. Without data, that debate could go on for a long time, and we still may end up with the wrong decisions. Specifically on this particular study, away from the numbers is the human story, which is about people who are ill getting access to the help that they need, and people who work in healthcare facilities getting to the points where they provide service. Both were disrupted to different extents, and the numbers are actually a demonstration of that reality. Higher procurement costs or shortage of items, workers who cannot access the places where they render service, and those who go to get care, limiting themselves so that only the very sick ones would attempt to negotiate their way on an uncertain day, and therefore you find the cost is higher because those accessing service are generally more sick than on a normal day. it is important that to the extent that's possible, we find a solution to the 4,000 or so doctors who are currently graduating from schools at a rate higher than our capacity to absorb them because of economic challenges. And one of the solutions that may come from the planned UHC rollout and the planned autonomy to facilities to employ, because there are 4 bills that are currently going through Parliament, and we are contributing to improve them, is that with greater resources being directed directly into the sector, we will be in a better position to absorb the healthcare workers that are right now waiting to be absorbed into the industry.